Hi, this is Dr. Scott Hoare, and this week's Treatment Tuesday, we're going to be with Joe Drake. Joe is from Intensity X3 Fitness in Boca Raton. So, Joe, tell us what's going on.
About 2 years ago, I had a pretty bad back injury. Couldn't walk for a couple of days. Recovered and kind of came back from that, but now, it's still like, if I'm not really on top of my mobility, or if I do a lot of deadlifting, hinging, picking things up off the ground, my hips have been bothering me. Low back, more so on the right side, and then also kind of further up into my mid back based upon what I'm doing. I'm on my feet a lot throughout the day, so days where I am a lot more active, I definitely just start to get a lot more discomfort and pain.
What happened 2 years ago?
I was working with a client, and I like a pair of push-up handles. They weigh nothing. I bent over with what I thought was, good technique and everything, and picked them up off the ground, and immediately, it was like a burning sensation in my back. Knew I had done something, and spent about 2 hours on the ground. I've been kind of dealing with it since then. I work in fitness, so I feel like I know what I'm doing for the most part. But
Sure.
Taking my time, getting back into exercise. It just, there's certain movements like deadlifting, for example. Barbell deadlifting, 2 legs, definitely just does not work with my body anymore.
You're not doing it anymore.
I'm not challenging my musculature as much as I would like to, like my leg strength, but it's just all my back and handles. It's like a guaranteed. Even if I don't feel it a lot then, it's like the next day things are just a little out of whack.
How does the back bother you in your normal life, like when you're with your family?
Maybe even more my lack of confidence is like I'll go to pick up one of the girls off the ground. I'm like, I don't know if I should lift them in this position. And so I just, I feel like I'm limited in like being able to play with them the same way, grab them up off the ground, worried about putting them in and out of the tub. And I'm like, I just know in the back of my mind, that's going to be like the next time I end up on the ground. It's
Sure.
something like that.
How does that leave you feeling?
Not great. But it's not really a position I'd like to be in, right? You want to make time for the things that you need to be doing. And I really honestly have been putting time into my mobility, into doing what, I've learned along the way for like stability work, trying to really help myself, and I'm just kind of hitting a wall at this point. It's nothing like what it was before. I just feel like I'm at a place where I'm not really sure how to get back to that, or if I can get back to that. And that's obviously, I got into fitness because of my love for being able to do all these things. So. Yeah. The idea of not being able to do it is, it's kind of defeating a little bit. I'm more concerned about all the other things you're going to find that's wrong with me too.
Sure.
Because I imagine there's, more going on than just my back injury that I had a couple years ago.
Okay. All right. Well, let's get to it. Let's figure out what's going on. Okay, so we did an initial examination, and we did a medical history with Joe. He certainly has some stiffness in his neck that he's been dealing with for a long time, so I want to check that out, as well as his thoracic spine as we work down to the lower back and the hips. He also had a little bit of ankle stiffness and limitation that he's always dealt with, so we're going to dive right in and get him his treatment. Is that a tender spot right there?
A little tight.
Yeah.
Yeah. Oh, there it is. Whoa.
Good.
Tell me how broken I am.
You're double broken. So I'm doing motion palpation to see how the joint moves and where it's restricted. Joe, what I'm going to do is bring it over here, and I'll give you a little thrust like that, okay?
Yep.
Breathe out. Good.
Out of place or what?
It feels stiff and restricted.
Yeah.
There's like a bounciness. Breathe out. Good. There's a bounciness to every joint, and these ones don't have it. And that's why I'm manipulating it here. Deep breath. Breathe out.
Oh.
Good.
It's like a little tickle spot there, just a heads up.
Yeah? Okay.
Maybe not with that, but.
Deep breath. Breathe out.
Oh, yeah, there we go.
So I'm feeling for the muscular tension in your neck here, Joe. Sometimes the muscles are so tight that they limit your joint motion.
There's definitely days where I can't look the same one way as I do the other.
Yeah. Yeah. So we had a little release there. While I was releasing his muscle, we had a joint cavitation there, which happens sometimes if it's real restricted. All right, so now I'll get in here and actually feel the joints. And we certainly have some stiff spots. All right. I'm going to do an adjustment right there, all right?
Yeah.
Yeah, let that drop. Woo, good. When was the last time you got your neck adjusted?
It's been a while.
Okay. Good. All right. Now I'll do some muscle tests, and that'll kind of tell me what segments I should pay attention to.
Yep.
Here. Keep your head right here. Shrug your shoulder up just a little bit. Good. And what I want you to do, I'm going to push your shoulder and your head away from each other. Don't let me do that.
Got it.
Ready, go. That's perfect. Now let's do the other side. Pushing here and here. Ready, go. Again. And that was certainly weaker, wasn't it?
Yeah, I felt like it.
Okay. So I'm going to do another adjustment to the C4 segment there. And we got a nice knot there too, don't we?
Yeah.
So
Usually on this side is where I feel more in the neck.
I'm going to go right in on this knot here. Sure, that feels pretty awful right now, yeah?
Yeah. I can feel it in my foot.
Okay. So he's got a little bit of a trigger point if it's radiating all the way down to the foot. So what I'm doing is I'm just pressing directly into that that little trigger point into the knot of his muscle, and that starves it of its blood supply, and then gets it to release a little bit. Good. We'll do just a little adjustment on this side, Joe. We're not expecting much of a release here. Yeah. Good. All right, head over here. I'm going to push head against shoulder. Don't let me. Ready? Go. Good.
Yeah.
And that was better, wasn't it?
Yeah, a lot stronger.
Good. Now, do some muscle test. Make a fist. Good. Right here like this. Hold on. Turn your wrist. There you go. I'm going to push your elbow down towards the table.
Okay.
Don't let me do that. Ready? Go. Very good. All right, your thumb and your pinky. I'm going to pull them apart. Don't let me do that. Go. That's not so good.
No.
All right, so those
Should I be
muscles,
strong with that?
you should be much stronger. We need to install those into your
that's not
Intensity X3 classes. All right, so those muscles, the nerve root that supplies those muscles comes out about right here.
Yeah.
And we knew that was real tender from when you're on your face down. I'm going to do a little adjustment. Good. Now thumb and pinky, pulling apart. Still a little bit weak there. I think it was a little stronger though.
Yeah.
So I'm going to look at your wrist.
Do more pinky exercises.
Good. Thumb, pinky, ready?
Yeah.
There we go, much better, yeah?
Yeah.
Okay, elbow in at your side. I'm going to try to pull your elbow over here. Don't let me do that. Ready, go. Very good. Make a fist. I'm going to push down. Don't let me. Ready, go. Perfect. Hold it right there. I'm going to push your arm out that way. Don't let me go. Good, and now that way. Don't let me. Perfect. We'll go to the other side here. Make a fist. Pushing your elbow down. Don't let me do that. So you don't have to win. Just resist
Yeah.
whatever my pressure is. Ready, go. Pretty good. All right. Thumb, pinky, pulling apart. Don't let me. Same deal.
Yeah. It's a little bit stronger, but still. Damn. I have to work on that.
Let's see if we can do something right here for you. Good. Thumb, pinky, pulling apart. There you go. A little bit better. So no pops, no cracks.
Yeah.
But clearly we just stimulated that joint in a way that kind of had a reset effect
Yeah.
on the way your muscles and nerves fire. Elbow in there. I'm going to pull your elbow over here. Don't let me. Ready, go. Perfect. Make a fist. I'm going to push down. Don't let me. Good. I'm going to push that way. Don't let me. Go. Pushing that way. Don't let me. Go. Cool. All right, breathe out for me. Good.
Yeah, I know whenever I've seen it, yeah, no doubt it doesn't.
Interesting.
That, and even sometimes they're just not moving at all. Like, that's one thing. Through some of the side stuff, he's, says it's oftentimes when I come in, usually if I'm feeling stuff up in like my left mid back, like my right hip is like super locked up and either not moving or.
So I'm going to mobilize your hip a little bit right now
Yep.
into internal rotation, which is where you're a little stiffer. That feels good, like it's gonna pop out, right?
Yeah, that doesn't feel great.
Good. And now this guy over here,
Yeah, that's like,
actually, I think your hip is shaped a little bit different. Have you been told this before?
no.
All right, so basically there's something called anteversion versus retroversion of your
Yeah.
hip. And it's basically where the socket of your hip, of the head of your femur, where is it pointing?
Yeah,
Your right side is pointing kind of normal.
yeah,
And your left side is pointing out a little bit more, meaning it's really easy for you to externally rotate, but then internal rotation is not easy, okay?
Yeah.
And that's
I see
just,
it whenever like when I do squat, even now, and it's hard because I don't remember before, but it looks like one of my butt cheeks is like lower than the other, like significant. You can see like a, not really so much a shift, it just looks like one of my, like my butt on one side is lower than the other. So I don't know if that's all related or what, but
and does it go where it's almost like,
one leg wants to kind of creep out, like my toe wants
Yeah.
to almost turn as I'm squatting a little bit.
yeah, I would allow it.
Yeah.
The left knee is gonna point out more. Don't fight that. You're not gonna fix that. I would just go with it and know your hips are a little asymmetrical.
Yeah.
That's not going to get fixed by me doing stuff. That's not going to get fixed by corrective exercises. Just squat that way. Go with it.
Yeah. Okay.
Having said that, we do want to open up a little bit of... Good. Okay, and I'm going to do a little bit of an adjustment into internal rotation with this left hip.
Yeah.
Let it go. Good. A little bit better internal rotation. Not perfect, but
Yeah.
better. All right, I'm going to muscle test on this side. So I'm going to push down like that. Don't let me do that. Ready? Go. Again. Weak.
Yeah.
Other side. Pushing down. Don't let me. Ready? Go. Okay.
Yeah. Big difference.
Turn on your side, face that way. So the muscle test that was just weak was one of your hip flexor muscles, the rectus femoris. And a lot of the innervation for the rectus femoris comes out of your L2, which is about right here.
Yeah.
So I'm going to adjust right there, okay? So let me see your arms. I'm going to yank on them. Head up towards me. Perfect. And we'll grab this. Take a deep breath for me. Breathe on out. No. We're going to go again. Deep breath, breathe out. Good. Lay on your back. Pushing down, don't let me go. There you go, much better, yeah?
Yeah, it's a big difference.
Perfect. I'm gonna push down and out. Don't let me do that. Ready, go. Weak. Down and out, don't let me go. Weaker. All right, legs together all the way. I'm gonna pull just this leg towards me. Don't let me do that. Go. Again. That all you got? This one towards me. Don't let me. Ready, go. Again. I don't like that. Bend your knees a little bit. What I want you to do is keep your knees together. I'm going to try to separate them.
Yeah.
Don't let me. This is just another muscle test. Go. And again.
And I get like doing that too, like pubic pain.
Yeah.
Yeah, for sure.
Okay.
Like I'm just not able to generate force without it.
Yeah. Honestly, that probably ties into the hernia
Yeah.
right there, because that's a lot of the stabilizing
Yeah.
forces right there, and then there's a leak with that hernia. So you stabilizing your lumbar
I'm just not able
spine.
to create the same like pressure.
Mm-hmm.
I feel that when I'm working out sometimes. It just limits me.
Makes sense. Pushing down and in, don't let me do that. Keep the knee straight. Ready? Go. Again. Uh-huh. Pushing down and in, don't let me. Man, that's not good. Okay.
I was expecting so many things to be broken today.
I mean, no, you kind of were though, weren't you?
yeah.
Why don't you flip around on your belly? Good. Muscle test, I'm going to push down like that. Don't let me go. Perfect. Other side. Pushing there. Ready? Go. Again. And that's weak, isn't it?
Yeah, a little difference on that side.
All right, turn on your side, this side up. So the hamstring was weak, and lots of the hamstring comes out of L5 right here, and that already went. didn't it?
just yeah.
All right, let's see if there's any more in here. Good. Pushing there, don't let me go. Much better, yeah?
Yeah.
Raise your knee up, hold it right there. I'm gonna push down, don't let me go. Good. Raise this knee up. Hold it right there, pushing down. Good. All right, flip around on your back. So those ones we tested earlier that were weak. Remember the inner thigh ones? Let's check those out. Pushing down and out. Don't let me. Good. Down and out. Don't let me. Much better. Legs together. I'm going to pull just this guy towards me. Don't let me. Go. Still a little weak, but not as bad.
Yeah.
Pushing here. Ready, go. Very weak now.
Yeah.
Okay, knees bent. We'll do the one where you're squeezing your knees together. Don't let me. Did you still feel the same pelvic sensations?
Yeah, feel stronger, but still feel like when you do that, it's like pulling right where that muscle's like attached to my pelvis. Just feels like unstable, or like I might strain something if I resist too much harder.
Okay, I'm going to do this muscle test again. Don't let me. Go. And that's the really weak one.
Yeah.
Turn on your side, face this way. All right, so now that we've gotten a bunch of those muscles to fire, there's one last big leak here, and it was your some of your adductors on your left side. So L4 on the left side, for the most part, correlates a lot to that. So we'll do one last adjustment here. And I'm going to bring you over there. Good. Breathe out. Good. Lean your back. Pushing right there. Don't let me go. Much better.
Yeah.
Bend your knees. Pulling your knees apart. Don't let me go.
Yeah, it felt a lot different.
Much stronger.
Yeah, it didn't
Good.
hurt down here.
All right. Now let's go to your feet. Can you take your shoes off?
Yeah.
All right. Relax this guy. All right.
Oh.
That's fun, huh?
Yeah.
That hurts.
Yeah, on that side.
So you got nice fallen arches, especially on the right.
Yeah.
Left is flat-ish, but the right one is particularly. All right, so number one, no flip-flops.
What's up?
We're done with flip-flops forever.
I live in South Florida.
I know. I know.
I honestly, I try not to. The only flip flops sometimes, like the UFOs, like, whatever. Yeah. So okay then. All right.
Hey man, you're a dad now. It's Tiva time, okay? Get the strap on the back of the. All right, I'll just do a little ankle dorsiflexion adjustment. So I'm going to yank on your leg. So can you just hold onto the table so I don't slide you?
Yeah.
There we go. Yeah. Good. All right. Your heel doesn't evert very well, so I'm going to use the speeder board here. So I'm going to do an adjustment on your heel. That kind of looks like I'm punching your heel.
Okay.
So we can get it moving into the eversion ranges of motion. One more here. Good. And there's a little bit better motion. All right. Just that ankle one, hold on.
Yep.
Let go. Good. Okay, good. Okay, so we found out a couple of things during his treatment. Number one, Joe actually has a hernia issue that he's been dealing with for a long time, and I think that really undermines the stabilizing forces of his core and his spine. So we were able to do a number of manipulations that actually turned on those stabilizing forces, like the adductors of your legs, and so we have those temporarily. So during this little window when he's a little bit stronger, we're going to do some stability exercises for his pelvis and his hip to try to kind of lock in as much of those stability gains as possible. And raise your butt up, hold it right there, and I'm going to bully you, and you're fine there. But if I push you that way, you're screwed. I'll put a band on you like this and make sure there's nice tension there. Good. And raise your butt up and now you have stability, right? Yeah. Okay, give me 10 reps. That exercise number one, was the single leg glute bridge. We looked at your ability to keep your pelvis neutral and protected while you extend through the one hip. What did you think of that exercise?
It definitely made a big difference having the band on my leg too, because I do a lot of glute bridge stuff. You know, like I feel like I know a lot, and probably more than most. But
Yeah.
I hadn't thought to do the band with a little external resistance, but definitely felt a lot different too.
Yeah.
So that's something I feel like I can start doing on a regular basis.
And it did seem to fire up those stabilizing forces that were lacking during your hip extension, and to where you really had better control. No stiffness or discomfort in your shoulder, your upper back, your neck as we do this?
No, it feels pretty good.
Good. But you have to engage all sorts of stuff down there, right?
Yeah.
So
I
keep
feel like
going.
I'm-
Do you feel like what?
I feel like I could fall off balance easily if I'm not really thinking about it.
Exactly. It really takes your focus. The second exercise, we looked at really doing lots of different exercises, but in that split stance sort of position, whether it's kneeling for what we did was, say, the overhead press, but also you mentioned you do really well with split squats, and anytime you're able to kind of lock in neutrality with your pelvis, sounds like you did pretty well. Okay, so that's our treatment today. Joe, what did you think of that?
There's more going on than even I thought.
Yeah.
I feel a lot better right now. A little bit more encouraged, at least seeing like some of the things that got stronger after some of the stuff that we were doing. There's hope for me.
Yeah, it did respond, right?
Yeah, so at least that's good. Some things that I came in knowing, especially just having my fitness background, knowing where I was probably weak, but then some other stuff that I was like, wow, yeah, I had first off like that blew my mind a little bit.
Right.
And then definitely like with my pelvis and my adductors, that was like just because of the pain that I had when we were doing it, I was like, yeah, that's not right. But like you said, it felt a lot better afterwards.
My overall findings, right, my thesis here, the hernia is undermining your ability to stabilize your core and your spine. And it was awesome that we were able to get it going. If you want to have the surgery, you should probably have the surgery. If you're looking to avoid the surgery, you would go through a series of treatments to see if, hey, can we lock in those stabilizing forces, even in the presence of an imperfect situation. That doesn't mean with an imperfect situation with your hernia, you can't stabilize perfectly. Seed planted as far as maybe you need the surgery, maybe you don't need the surgery. I don't know, and we're not able to tell just from this one treatment alone.
Yeah.
But there's one thing for sure is your body did respond and created those stabilizing forces.
Yeah.
We don't know how temporary it was.
Yeah.
You knew your neck was stiff. You know that's a contributing factor. If your neck is a little bit limited in its range of motion and its movement, it opens the door to additional stresses on the rest of your body because the neck is the initiator of movement. So yeah, you want to get that neck moving a little bit better, and you want to get to the point where you can stabilize your lumbar spine and your pelvis a little bit better.
Yeah. Are those, like the exercises we did, is that stuff I should be doing every day right now, like the glute bridge? I mean, I'm sure that, maybe I shouldn't overhead press every day, but are the stuff that we did, are those things I could or should be doing daily right now?
Yes.
Help with that?
Yes, I would absolutely recommend you do it daily. Yeah. And in the absence of doing it daily, do it as a prep before more aggressive exercise.
Yeah.
Okay, because you're turning on those stabilizing forces. So it'd be nice if they were present when you go do burpees and lunges and squats and God knows what. What you could take from this is doing the single leg kneeling stance for your bicep curls, military presses, landmining from a single knee position or just a split position. It allows you to really lock in that neutrality and that safety with your lumbar spine. So yeah, I would recommend you do them on a daily basis, but just more incorporate those sorts of positions into your fitness routine.
Yeah. I guess my question would be, is it avoid the back squatting, the barbell deadlifting? Do you feel like that's something I'll be able to get back into or just like yet to be seen?
What I didn't like was when you squatted too deep, because you had what we call the butt wink, that pelvic tilt, which is a sign that you've lost neutrality, you've lost stability of the lumbar spine. I wouldn't write them off. Once we get some of these stabilizing forces into place, like what we created with the single leg glute bridge, right? When we got those adductor muscles, if those are all firing, then going and doing the weighted deadlifts, the weighted squats, I think would be a lot safer for you.
So I'm not a lost cause then?
You're not a lost cause. No, you definitely responded great, and I think there's no reason why you wouldn't continue to respond well. All right. Well, Joe, thank you so much for joining us. You are a great patient today.
Appreciate it.
Thank you so much for watching from at home. So you can find Joe at Intensity X3 in Boca Raton. He's also with the Axiom Academy. And don't forget to hit the like button, leave a comment, and subscribe. And check out our next Treatment Tuesday next week.